recorded.
Welcome, everybody. We'll just give it 1 more minute for other attendees or participants to join. Hello, everyone, and welcome to the Infection Prevention for Diagnostic Imaging for Today and Beyond COVID-19 webinar. I'm overjoyed to have you all here for this educational opportunity gathered from across the United States and beyond. It is a pleasure to be with you today. My name is James Hunt, and I am a clinical application specialist for North America, and it's a pleasure to present this opportunity on behalf of Philips Diagnostic Imaging Education. Agenda for today, log in, welcome for the next couple minutes. This shouldn't last an hour, but this is just kind of an agenda that we have time frame. Lecture next, question and answers, best practices and resources towards the end, and then we'll adjourn approximately 11:50. If you have any questions, please utilize the question and answer tab and type those questions in there, and we will answer those at the end. About me a little bit, my current position with Philips Education is a senior clinical education specialist for North America. I got one daughter, aspiring orthodontist at OU, Boomer Sooner. I've been with Philips since 2011, and I've been in radiology since 2000. I've actually been in the medical field since 96. The challenges in our world today, today's healthcare environment, we're faced with the reality that every patient is a potential carrier of a communicable disease or infection. COVID-19 coronavirus, these are the numbers that we have as of today versus the 2019-2020 flu season. The challenges in our world today, it's our job to make sure that the contaminants that we leave behind don't reach other patients. Evidence here has shown that the HCAI can occur in both the inpatient and outpatient settings. Found at the machine control panels, working monitors are the most contaminated objects in the radiology department. Role of the imaging of the COVID-19. These are the pockets of regions and the countries where general X-ray and CT is being used for diagnosis. Unavailability of PCR kits, PCR turnaround times are too long, and the sensitivity is too low. General X-ray and CT has shown value in the early diagnosis of COVID-19 through facilitating detection of pneumonia and assessments of the course of the disease. Types of infection transmission. We have direct contact, airborne, droplet, enteric, and bloodborne. A lot of these are common for us in the medical field. I'd like to first start by discussing how infections spread. An infection first needs a source, an infectious agent. This can be viruses, bacteria, or other microbes. Infection sources found in the healthcare settings can include patients, healthcare workers, surfaces, and other environmental items, visitors and family members. People can carry an infectious agent without showing any signs or symptoms of illness. Common environmental items that may harbor infectious agents do include dry surfaces like countertops, bed rails, medical equipment, wet surfaces and moist environments such as sinks and faucets and medical ventilators, um, indwelling in medical devices to include catheters and IV lines, and construction dust and other debris. The next step in the chain of infection is to have susceptible person. These people who are not vaccinated or immune to a specific infectious agent or who comprise immune system. There are many factors that may increase a person's susceptibility to infection. Underlying medical conditions like diabetes, cancer, and organ transplantation, as these can weaken a person's immune system. Taking certain medications, including chemotherapy, steroids, and antibiotics, can increase the risk of some infections. And medical interventions such as surgery, urinary catheters, and intravascular access lines, as these provide additional points of entry to the body for infectious agents and may increase the risk of infection. Lastly, to cause infection, these infectious agents need to be transmitted to a susceptible person. General modes of transmission include contact, sprays, splashes, inhalation, and sharps injuries. Preventing or controlling the spread of infectious agents through these common modes of transmission require different level of precaution be taken depending on the infection of concern and patient or environmental factors. We will now discuss what these precautions are. Standard precautions were developed in 2007 by the Centers of Disease Control and Prevention and include what may be familiar with us as universal precautions. These simple mitigation efforts serve as a primary way to prevent healthcare associates of infections. Standard precautions apply to all patient interactions and include performing proper hand hygiene, using PPE where there is anticipated contact with blood or bodily fluids, proper cleaning and disinfection of equipment, linen and laundry cleanliness, safe injection practices, and appropriate sharps handling, and placing patients into appropriate levels of advanced precautions if warranted. The second tier of infection control practices beyond standard precautions is transmission-based precautions. These are used in conjunction with the standard precaution and are broken into three distinct categories: contact, droplet, airborne. We'll discuss each of these individually, starting with the contact precaution. Contact precautions are used when patients are known or suspected to have infections which pose a higher risk for direct or indirect contact transmission. Contact precautions include placing the patient into a single patient space, like a private room, using appropriate PPE, limiting patient transport through the healthcare facility, utilizing dedicated or disposable patient care equipment, and after frequent cleaning and disinfecting of patients' rooms and spaces. Hand hygiene and other standard precautions are still required when interacting with patients in contact isolation. Gloves and gowns are required PPE when providing care to these patients. Common pathogens that patients may have which require contact precautions include hepatitis B and C, human immunodeficiency virus, C. diff, MRSA, and norovirus. Be sure to follow the correct hand hygiene procedure depending on what pathogen your patient is known or suspected to have. For example, C. diff is not killed by alcohol-based hand sanitizers, and so healthcare workers must use soap and water when working with patients with this infection. The next transmission-based precaution we'll discuss is droplet precaution. This is used when patients are known or suspected to have infection caused by pathogens transmitted by respiratory droplets. These droplets are typically produced by coughs, sneezes, and even talking. Droplet precautions is implemented only if the droplet is greater than 5 micrometers in size. It is possible for the respiratory droplets to travel up to 6 feet. Droplet precautions include placing the patient into a single patient space like a private room, using appropriate PPE, limiting patient transport through the healthcare facility, and placing a mask on the patient. Again, hand hygiene and other standard precautions are still required when interacting with patients in droplet isolations. Additional PPE includes a procedural mask and eye protection. Common pathogens that patients may have which require droplet precautions include influenza, B. pertussis or whooping cough, strep, adenovirus, rhinovirus, and mycoplasma pneumoniae, which is commonly referred to as the walking pneumonia. The final transmission-based precaution category is airborne precaution. This is used when patients are known or suspected to have infectious transmitted via airborne particles. These particles are smaller than the ones protected against through droplet precautions and measure less than 5 micrometers and are able to travel long distances in normal air currents while remaining infectious. Airborne precautions include masking the patient, placing the patient into an airborne infection isolation room, restrict susceptible personnel from entering the air, use appropriate PPE, limit patient transport throughout the facility, and immunizing susceptible personnel following unprotected exposure. Just as we mentioned with the other transmission-based precautions, standard precaution measures include hand hygiene are still required when caring for patients with airborne isolation. In addition, healthcare workers must wear an N95 particulate respirator or powered air purifying respirator. Common pathogens that patients may have which require airborne precautions include measles, varicella, commonly known as chickenpox, tuberculosis, Aspergillus species, which cause fungal infections, smallpox, and COVID-19. Let's take a closer look now at infection control in the setting of COVID-19. This novel coronavirus is primarily transmitted through droplet and direct contact. Facilities should follow standard environmental cleaning and disinfection procedures in accordance with local guidelines. When provided direct care to patients with confirmed or suspected COVID-19 diagnosis, healthcare workers should use standard contact and airborne precautions with the addition of eye protection. It is important to follow the proper workflow when donning and removing PPE in order to avoid contamination and break the chain of infection. The CDC has many helpful resources, including these posters, which are available to download as a PDF document from the CDC. Areas of contamination, general usage areas of floors, doors, sinks, soap dispensers, patient transport equipment, the whole hospital environment. Imaging equipment, the X-ray machine itself, touchscreens, patient transfer devices, monitor devices, X-ray detectors, computers, and mice. Preventing infection, general hygiene, hand hygiene to include PPE, patient handling, isolation protocols, disposal protocols, equipment disinfection, and environmental infection control. Try to avoid contamination if at all possible. We know it's not always possible. During examinations, protect the equipment by covers and drapes as far as reasonably possible. You will minimize the need for cleaning and disinfecting. In the cleaning program, all parts should be only wiped clean with a damp cloth and detergent and then rubbed down with a dry soft cloth immediately. Never use corrosive cleaning agents, solvents, abrasive detergents, or abrasive polishes. If you're not sure about the properties of a cleaning agent, do not use it. This is the cleaning aspect. We will go into the disinfecting next. We do have disinfection. The disinfection method is used to conform to all legal regulations and guidelines regarding disinfecting and explosion protections. Those parts of the products that are suitable for such treatment, including accessories, cables, by wiping them down with a cloth dampened with the suitable disinfectant. Observe the warnings of the manufacturer of the disinfectant. If you do not know the properties, do not use it. Use of disinfecting that contains one of the following: ethanol or isopropyl 70%, hydrogen peroxide up to 90%, chlorhexidine 0.5, and ethanol 70%. Plastic surfaces should only be treated with the disinfectant that contains ethanol or isopropanol 70% or hydrogen peroxide up to 25%. May not contain chlorine, surgical spirits, amines, and ammonia compounds. If you use such disinfectants, the material can become dull and tend to crack. Spray the disinfectant directly on the cloth or the towel and then wipe the surfaces. If you were to spray directly onto your machine, because of uneven edges, crevices, gaps, buttons, unsealed margins, hinges, the disinfection can get into the product, causing electrical shorts, metal corrosion, and other damage. This is our reference for our cleaning and disinfecting program from Philips. It is available to download at philips.com healthcare/services. Workflow for the imaging suite and portable exams. Workflow efficiency suggestions: clean your areas that are visibly soiled prior to disinfecting. Clean every aspect of your room: the tube head, the table, sponges, chairs, stools, countertops. Be sure to discard your gloves and then sanitize hands, preferably with soap and water. While you're in the imaging suite, or while the imaging suite is drying from your cleaning and disinfecting, finalizing your paperwork, entering in the new patient information, and setting up the room for your next patient. Prepare items such as wireless detectors, sponges, holders. Do not leave items in the room or on the portable that are not needed for the current procedure, i.e. positioning aids, extra lead, extra boxes of gloves, hanging items off the side of the mobile unit, extra pillows and linen. Portable exam suggestions is the radiographer is to abide by all local precautions given in the infectious preventive and control measures on the necessary steps to limit the transmission. When utilizing a lead gown, please clean both sides, front and back, before putting on your PPE. Clean the mobile x-ray, especially the wheels. Drape the machine with plastic wrap if possible, and alternatively use non-alcohol germicidal disposable wipes when resources are low. Be sure to clean both sides of your detector or x-ray cassettes, and if you can, place in 2 layers of plastic bags. Once you make your exposure, the removal of the cassette from under the patient and the detector from the bags, dispose of the contaminated bags, and then follow with cleaning your x-ray machine and your equipment as recommended. 2-tech shift, if at all possible. Working in twos, a clean technologist and a dirty technologist always helps. One technologist, is the dirty technologist in the room with the patient with the proper PPE, and then the clean technologist stays at least 6 feet with no patient contact during the exam for any post-processing workflow, paperwork, exposures, or finishing the procedure. Use the procedure, once the procedure is complete, the dirty technologist will then safely transport their patient back to the method and disinfect the scan room. The clean technologist finishes the process and disinfects the scan control area. It is important to take the time to properly prepare the equipment for each patient by cleaning and disinfecting each area to prevent the spread of infection. All right, now it's question and answers. Let's see if there's any questions. There are no questions. Does anybody have a question as of this moment? I'll give you a couple 30 seconds here if anybody has a question. No question. So let's stay connected. www.usa.philips.com/healthcare and at www.usa.philips.com/healthcare/medical specialties /COVID-19. Below links for Twitter, Facebook, LinkedIn, and YouTube. Online resources, cleaning and disinfecting guidelines, the Center for Disease Control Prevention, and the American College of Radiology. That is all for today. I would like to thank each of you for listening to our new webinar. We appreciate it, and have a great rest of your weekend.